Our first speaker is Sue Dempsey. I would like to call upon Sue up on the stage. So Sue Dempsey is the State Drinking Water Administrator. She has been with the DHHS for 25 plus years, previously as the State Toxicologist. Sue is a member of the Association of State Drinking Water Administrators and American Water Works Association, the Nebraska Rural Water Association, and the Society of Toxicology. She currently serves as president of the Nebraska Environmental Health Association, serves on the board of the Nebraska Well Drillers Association, and is an appointed member of the State Emergency Response Commission and the US EPA's Science Advisory Committee on Chemicals. Sue is also an adjunct faculty member at Doane University. Sue's going to speak on public health impacts of water quality. Let's give a big hand to Sue Dempsey.
I added a few extra slides last night about 10:30, so hoping you got those. I'm going to talk about contaminants that you're not going to expect me to talk about. You guys are all familiar in this room about things that are regulated, such as nitrates. I'm going to talk a little bit about unregulated contaminants and things that are considered emerging contaminants of concern. I pilfered the water tower photo from Pinterest. I thought that was pretty cute. And I always have somebody that's unfamiliar with water look at my PowerPoints. My 96-year-old neighbor said, I didn't realize they separated it into hot and cold water. Anyway, you can go ahead and switch if you would. So this is what we're going to talk about today. Mike, did you speak already? I think so, yesterday. So I'm going to touch on HABs, but not from the recreational side, from the drinking water side, and just briefly. We're going to talk a little bit about Legionella, Manganese, and PFAS chemicals, and then 2 pending grant applications that I've applied for. So as far as HABs, I worked with Mike this year to determine locations that have surface water impacts. We did this last year as well, but we added a few additional locations this year, and those are listed here. We sampled the source water, the Little Nemaha, Longs Creek, Beaver Lake, Cedar Knox. Some of these you're familiar with. They are surface water systems. We are fortunate in our state that the majority of our systems are groundwater, and we don't have to deal with this sort of issue like some states do up by the Great Lakes area. To date, we've had no microcystin hits in surface water, in drinking water, which is good. This is our most recent data from that sampling event. Mike is the new number 4, is that correct? And as you can see, we're well under those levels. 8. Since Mike covered all of that, I'm not going into any more detail. This is the thing that keeps me up at night, Legionella bacteria. We talk about this a lot on the national level. The reason this is a big issue, it's the only waterborne disease where death is a typical outcome. In healthcare-associated cases, it's about 25%. New data that I've seen, it's closer to about 30%, and the cases keep going up. If you want to go through these 3 slides to show how that's been going up. It's keeping me up, as you can see. There's a lot of reason for this. The reason that there's increase in cases. One is doctors are more aware. So if a patient comes in with pneumonia-like symptoms, they're now testing them for Legionella as well. So we have more awareness. The other reason, if you did the math and started to look at the cases, when we started coming up with green buildings, so low flow in buildings, this really has paralleled the increase in Legionella cases, and I'll talk about that a little bit more. Outbreaks most often occur in long-term care facilities and in hospitals. Hot tubs are notorious for Legionella. Since I've been made aware of this issue, I haven't been in a public hot tub in probably 3 years. Also water features. If you think of any hospital you go in, there's water features. Those are notorious for having Legionella. Some states are now banning those in facilities where people are cared for long-term. Legionella is not a bacteria that you are concerned with ingestion. It's inhalation as far as breathing in vapor. So when you think of it, think of a mist, like when you take a shower, low flow issues, hot tubs in particular. Whenever cases have been detected, there's usually something external to the building that has caused that to be an issue. But a building water system is the perfect ecosystem for Legionella bacteria. So even though we might be delivering clean water or safe water to the building, once they get into that system and there's dead legs or the temperature isn't high enough to destroy the bacteria or they don't have treatment, biocide treatment, you get growth in those facilities. A publication not too recent, a couple years ago, said that 9 out of 10 cases can be resolved by having really good management practices in those buildings. You can't get rid of Legionella altogether. So there's a lot of push right now for systems to test. I'm not a strong advocate for that. I think if you test for it, you're going to find it. It's a matter of making sure that you're testing for the right things. Is the temperature in the building being maintained at the right temperature to kill this bacteria? But then you dampen down the temperature before it reaches the patient, obviously in the shower with temperature control devices. Do you need to do treatment? Are you flushing? Do you have rooms in your facility that aren't occupied? Sometimes whole wings that aren't occupied. I am working on a grant with CDC right now, and we're trying to develop a risk management template for facilities in our state. Working with the long-term care facility, the main providers, which is Good Sam, Trillium Healthcare, the VA, some of those. We're putting together the best of the risk management plans that they have currently. Some states are doing an inventory of cooling systems in their state. I've had several contractors approach me for doing that. I'm also on a work group with the Association of State Drinking Water Administrators. We have our national meeting at the end of the month. I'm giving a presentation there about that CDC grant. But it's something that we probably spend about 25% of the meeting now talking about. I also attended an international Legionella conference, an entire conference dedicated to Legionella last month, and it was pretty eye-opening. CMS, which is the Centers for Medicaid and Medicare Services, require facilities to have these risk management plans now. CDC has a guidance document, a toolkit on helping facilities do that. I've been lecturing to long-term care facilities and hospital associations for about 3 years now about this issue. And they all are doing something a little bit different, which is why we're going to develop a template, hopefully, for them all to use. Manganese, something that you probably wouldn't expect me to talk about today. Iron and manganese are considered secondary contaminants, primarily an aesthetics issue. People think of discolored water. But manganese is actually a neurotoxin. And at low levels, it's an essential nutrient. You need it in your diet. It's essential for bone development and several other body functions. The FDA has levels that are recommended that you ingest every day. And if you notice the units, that's what I want you to notice today. It's in milligrams per day, so 2,000 to 7,000. It's naturally occurring. It's naturally occurring in the rock, particularly in the eastern part of our state. And as the water runs across it, obviously it's picking it up. 50 is the secondary MCL, and that's the level where most people can see it, taste it, or smell it. So that's where you get that brown discoloration in your water. EPA also has a health advisory for manganese. So at higher levels, around 300 is their health advisory. It's not safe for babies to drink. And the reason that is infant formula, particularly rice and soy formula, is really high in levels of manganese, somewhere up to 100 times that of breast milk. It's good for development for babies, but it's not designed to be mixed with water that also has high levels of manganese. So when I started last October in this particular job, I started requiring, I guess not requiring is not the right word, requesting that systems that test public notice in their communities. So Columbus, for example, West Point has received a lot of news to let folks know in the community that they shouldn't be mixing this water with infant formula. Another reason, as I mentioned in the bottom of the slide there, they absorb it more readily than older children and adults, and they also have trouble excreting it. I'm sure everyone's heard about PFAS. That's kind of the hot topic right now in EPA's neck of the woods. You know, I've been in this industry for 25, almost, well, I've been with the state 32 years, for God's sakes, forever. But I've never seen anything move at this speed. I remember when we started talking parts per billion, I thought that's ridiculous. How can we test that low? Now we're talking parts per trillion. But it's something also that we're being aware of and we're testing for. They do have a lifetime health advisory right now of 70, and that's for combination of several of the PFAS chemicals. There's about 15 that we have good analytical methods for currently. Several states are developing their own MCLs or levels, and those are hovering in the teens, primarily some states on the coast. They're very persistent, they don't biodegrade, and they're practically in everything that we use. They're not new, they're referred to as an emerging contaminant. This table's probably impossible to see from behind, but they were invented in the 1930s. They're just now being tested for more frequently is the issue. We have methods to do so. But they're in anything that's got coating on it to protect it, to make it slick, the thing that makes your tent water repellent, the pizza box that you don't want to stain when you carry it home, those sorts of things. But AFFF is probably where they're most abundant, and that's firefighting foam. Not all firefighting foam, but firefighting foam that contains AFFF is really high in levels of these chemicals. There's studies in animals, several different effects depending on the particular chemical, and it's really an emerging science as far as human health effects. Immune system, high cholesterol, thyroid hormone disruption, decreased infant birth weight. There's all kinds of health effects. I think if you look up anything, you can tie it to one of the PFAS chemicals as far as health effects. We started testing with the EPA as part of their unregulated contaminant monitoring rule. They do this for manganese as well. Any system greater than 10,000 they test, but smaller systems they do not, except for a splattering of them, so to speak. So we're doing some testing on our own at NDEE. We've tested around both of the Air Force bases, Lincoln Air Force Base and Offutt, because of the use of firefighting foam in those areas. We did find really high concentrations on site. We've also tested private wells in the area and luckily have not found anything, so that's good news. NDEE has also done an inventory of facilities that use or manufacture these chemicals in our state. So when I talk about grant applications, 2 grants that I've applied for. One is I'm working with the local health departments. It's a national effort to characterize lead in drinking water in schools. So I'm working with the health department. I have a meeting with them in a couple of weeks to prioritize the elementary schools and the child care facilities in our state. We have very limited dollars. I think it was $20 million nationally they provided, so it's a drop in the bucket for each state. So we want to maximize those dollars, focus on the kids that are most impacted, and that would be the age range of 0 to 6. So you'll be hearing more about that here in the future. And then I also applied for a grant to do characterization of manganese in community water systems in our state. Since EPA tests those systems greater than 10,000, I want to test those systems smaller than 10,000 so we get a good picture of the issue. We're also going to map that, showing the formation that the well is screened in to see what patterns that we see there. And that's all I have.